So, what exactly is a stroke? What exactly is a TIA, a transient ischemic attack? Let's appreciate the fact that strokes and TIAs occur in the brain. These are collectively known as cardiovascular accidents. The term cardiovascular accidents is it's an umbrella term, and it also includes angina and heart attacks. So, long and short of it is that these are in their entirety referred to as thromboembolic events. Thromboembolic events actually also encapsulate a couple of other conditions, namely your pulmonary embolism and your deep vein thrombosis, amongst a few others. Let's keep to the stroke and the TIA for the purpose of this video. So, a stroke I'm going to begin with, and a TIA, let's say, both occur, as I said, in the brain. These are incidents, both of them, whereby you get a thrombus, a blood clot, and it causes a blockage in a blood vessel in the brain. Now, if I cause a blockage in the blood vessel in the brain, blood can no longer pass that blockage, that obstruction that is. As such, blood can no longer go and supply the area of the brain parenchyma which was being supplied by that blood vessel. This in turn leads to death of that area of the brain parenchyma. Now, let's also understand that the brain, essentially, the brain parenchyma is made up of a whole collection, a mass of neurological cells for the most part of it. There are various different types of cells, astrocytes, oligodendrocytes, and so on and so forth. But long and short is that this is all neurotissue, i.e. nerve-based. It's kind of the central processing unit in a computer. Now, it controls all our coordination, our sensation, our movements. It controls literally everything we do. We know that. That's what the brain does. It controls what we do. And so what happens is if you are going to deprive that brain parenchyma, that neurotissue, of fresh blood supply, which is oxygenated, it's not going to be able to respire, and as such it will die. It will undergo ischemia initially, followed by death in its entirety, be it infarction or otherwise. So the area of the brain parenchyma that reflects a certain part of the body, so there is something what we refer to as a homunculus. The homunculus, you can Google this term, is essentially referred to as the map of the brain on the body. So certain parts of the brain will control certain parts of the body. Now, let's say, for example, so let's also appreciate that the right side of the brain controls the left side of the body, and the fact that the left side of the brain controls the right side. And this is because of the spinal tracts and how they descend and decussate, i.e. cross over. But keeping to the point of the stroke being a thromboembolic event, such that the blockage has deprived that area of the brain from fresh oxygen and blood, it is therefore going to undergo ischemia and infarction, therefore death. So the part of that brain parenchyma which is dying, if that reflects, say for example, the right leg, you will then experience pins and needles, and or weakness, and or numbness, and or other neurological symptoms. It is this reason when somebody presents to us in the clinical setting with any symptoms that might resemble reflecting a neurological deficit that could be otherwise reflected in the brain, and it's not explained by the musculoskeletal system, we will consider the patient has undergone a cardiovascular event, be it a stroke or a TIA. So now let's appreciate I have a patient who comes in and presenting to me with pins and needles of the right arm and leg that came on spontaneously. I've got to clinically contextualize how this has occurred, in what context, the risk factors that might be associated with a cardiovascular event or an accident. The difference then lies in, okay, I've explained what stroke is, death of the brain tissue, that is occurring due to a thrombus, a blood clot in the brain blood vessels, and therefore the lack of fresh oxygen and blood supply to that part. What is then a TIA? A TIA is a transient ischemic attack, also known as a mini stroke. Transient refers to the period that is temporary, short-lived, hence transient. Ischemia refers to death of tissue that is reversible. And the attack is obviously the term that we say the event that is. So a transient ischemic attack implies that the said deficit, the said neurological deficit, so in my case, the example I gave with the right-sided arm and leg symptoms, the pins and needles and or the weakness that occurred, was short-lived. It lasted for 15 minutes, say, for example, after which it resolved. Contextualizing that, this could well have been a transient ischemic attack. And again, I've got to put the case together in the clinical context, i.e. look at the risk factors and so on and so forth. Is there any other explainable cause? In the absence of other explainable cause or plausible causes, it warrants referral to the TIA pathway. So I must execute the said pathway and make sure that the patient is safe and not at risk of developing a full-blown stroke, because a TIA predisposes you to a full-blown stroke. And a full-blown stroke can lead to permanent hemiplegia if we do not act fast. Pardon the pun, FAST was the campaign that the government in the UK pushed. F for facial asymmetry, F for face, A for asymmetry, arm, the weakness in the arm, S for slurred speech, and T for time. Let's act fast, because you have a 4 to 6 hour window in which to thrombolize a patient and so on and so forth. So we won't go into the guidelines or otherwise. Keeping to the point, a transient ischemic attack, the event is transient. It will resolve. Now, in previous, in the former guidelines, in the previous guidelines, the definition of a TIA was the fact that the said symptoms resolved, and therefore, whereas the stroke symptoms, the neurological deficit, did not resolve. Whereas the newer guidelines, they actually say, no, we're going to put a time period on this, and the said time period is 24 hours. So if a patient experiences a neurological deficit to the effect that I described a few moments earlier, and that neurological deficit lasts in excess of 24 hours, by definition, that is now classified as having undergone a stroke, whether or not they resolve, i.e. spontaneously recover. If the said symptoms last less than 24 hours, then that was a TIA, transient ischemic attack. Now, again, as much as guidelines are there, they are guidelines, and so what really happened in reality is we contextualize this and we determine through a thorough detailed history and a thorough investigation with a proper clinical evaluation whether or not the deficit or some remnants of the deficit still are present. And in the said situation, we may, other than actually perform a CT head, looking for a bleed or evidence of an acute bleed, what we call an acute intracranial hemorrhage or bleed, infarct. We may also consider performing an MR scan if there is need for, and the CT scan doesn't yield anything obvious. So there you are, a stroke and a TIA. A stroke is by definition, a neurological deficit that lasts in excess of 24 hours. A transient ischemic attack is a neurological deficit that lasts less than 24 hours. And the situation is such that the stroke has led to infarction of the brain parenchyma due to a blood clot, a thromboembolic event, as does or venous thromboembolism, venous thromboembolus is VT, what we otherwise refer to them as. And a TIA is where the said neurological deficit actually recovers. Thank you for watching.